In this final talk on the endocrine system, we're going to look at the neuro-immuno-humoral response to trauma. Again, just to remind us of the case we've been looking at throughout these talks, we will revisit this case at the end of this short talk and discuss in a little more detail. So in this lecture, we're really going to look at the neuro-immuno-humoral response to trauma or to injury. This also applies to acute illness as well. And with regard to the humoral aspect of this response, we need to think about our main endocrine pathways as listed here. So when we're thinking about the neuro-immuno-humoral response to trauma, we need to understand that these three regulatory systems work in concert and do communicate with each other. So although we're going to describe them separately, we need to imagine these things happening together and one system impacting on the others. So to start with the immune system, after severe injury, there's a generalized systemic inflammatory response, very similar to what we see in sepsis. The general immune response is triggered, and there's a rise in many inflammatory mediators, including tumor necrosis factor, interleukins 1 to 6, and cytokines. And these have effects on the inflammatory response, on tissue and cell breakdown, on hemostasis and coagulopathy, and on the wider organism in terms of effects on, for example, the cardiovascular system. Specifically, the response can also affect metabolic pathways such as glucose homeostasis, and promotes catabolism and breakdown of larger molecules such as proteins, fats, and carbohydrates. If we just stop for a moment and think about how this affects the older patient, well, we know that older people have a more exaggerated general immune response anyway. So in these patients, the systemic inflammation caused by severe trauma can be even worse and more prolonged than in younger people, and therefore can have a more deleterious effect. Similarly, there are some underlying issues with increased coagulopathy in older people, and of course, if we then activate the hemostatic and fibrinolytic pathways, this can be exaggerated. And conversely, B and T cell specific immunity, such as B and T cell lymphocyte activation, is somewhat suppressed in older people. So any more specific immune response is less marked in an older person. So for example, if after trauma an older person then develops a secondary infection, their specific immune response to that infection may not be as good as in a younger person. Let's think about the humoral response. So in general, we can think of this as an exaggerated catabolic response to injury or illness due to activation of several counter-regulatory hormonal systems, including the hypothalamic pituitary adrenal axis, increased secretion of growth hormone, adrenaline, and activation of the hypothalamic pituitary thyroid axis. This generally leads to a hyperglycemic state with increased catabolism and breakdown of protein and fats, leading to ketosis, as well as to breakdown of, for example, skeletal muscle. In top of this, there is a degree of insulin resistance, which is responded to by hyperinsulinism. However, there is still a general high PER, hyperglycemic state in many patients with serious injury or illness. Finally, if we look at the neural response, there's really stimulation of the sympathetic nervous system, and that affects many systems within the body. With regard to the cardiovascular system, there's an increase in heart rate and stroke volume in an attempt to increase cardiac output. There's also vasoconstriction to divert blood to the essential organs, the brain, the heart, and the lungs. But of course, remember that vasoconstriction then leads to anaerobic situations in non-essential organs such as the gut and the skeletal muscle. There's an increase in oxygen consumption, which leads to an increase in minute volume, tidal volume, and respiratory rate. The overall neurohumoral response can cause mismatches with vasoconstriction and vasodilation within the lung, and that can lead to ventilation perfusion mismatch. In very severe cases, the lung ischemia and general inflammatory response to the lung, in the lung, particularly the effects of things like cytokines, interleukins, and tumor necrosis factor at a local level in the lung, can lead to ARDS. The blood flow to essential organs such as the brain and the kidney are somewhat preserved, and the glucose that is being produced by these hypercatabolic states is really being produced so that these organ systems can be nourished at the expense of less vital organs. It should be remembered that the blood flow to the kidneys is very dependent on general cardiac output and the effects of the renin-angiotensin-aldosterone system, which would be triggered. And actually, the reduction in blood flow in an attempt to reduce urine output and preserve salt and water retention can be severe enough to lead to renal, cortical, and medullary necrosis. The non-essential organs suffer in this setup. So the GIT, the skin, the musculoskeletal system suffer from reduced blood flow and reduced energy consumption, and there is a risk of tissue ischemia and buildup of lactic acidosis due to anaerobic metabolism in these organ systems. So let's go back to our older gentleman who was brought in after his road traffic accident. We can see how everything we were describing, the exaggerated immune response with the production of high levels of interleukins, tumor necrosis factor, and cytokines, can lead to local inflammatory responses and more general effects such as catabolic state, vasoconstriction, and ventilation perfusion mismatch in the lung. The hormonal changes tend to promote a catabolic state with high PER glycemia and an increased metabolic rate. There's breakdown of tissues with the breakdown of proteins and fats. It's a promotion of ketosis, metabolic acidosis, and high PER glycemia. In addition to all this, the neurological response with the high levels of circulating catecholamines and the increase in the sympathetic nervous system leads to vasoconstriction, redirection of blood to essential organs, and ischemia and anaerobic respiration in non-essential organs. The key here is to minimize this disruption in the metabolic state by appropriate resuscitation and supportive measures while the body is allowed to heal itself. If we go back to our second talk, we would also realize that many of these responses tend to be somewhat exaggerated in older people and require a lot more meticulous management for favorable outcome. So if you have any questions about this or any of the other talks, please feel free to ask them in class. And this ends our series of talks on the endocrine system. So in summary, we looked at the overview of the endocrine system, aging, and then the neuro-immuno-humoral response. Thank you.